Hello. Hello and welcome, everybody. January is Cervical Cancer Awareness Month. And as this month closes, we have today three very interesting guests to deep dive into the topic. Let me start with a round of introductions. We have with us from WHO Maribel Almonte. She's the lead for cervical cancer screening and treatment. Then we have with us Victoria Baptiste, who's WHO's Goodwill Ambassador for Cervical Cancer Elimination and also a registered nurse. And what you all may not know that Victoria is also a Lax family descendant who has been advancing Henrietta Lax's legacy and has also been named one of BBC's most influential women in 2022. Finally, from Singapore, we have Summer, who is a cervical cancer survivor and also an advocate. Summer was diagnosed with cervical cancer at the age of 24. She's now an ambassador of the I Am campaign of the Royal Commonwealth Society of Singapore and also a youth advocate. Welcome, everybody, and let's start the conversation today. It's a very important topic. We are live streaming on our WHO channels, Twitter, Facebook, and LinkedIn, and we will intermittently ask questions from our audience. So please use the hashtag AskWHO, and we will try our best to answer your questions. Let me first come to Maribel. Maribel, could you just set the scene for us? What is the burden of cervical cancer and who is at risk?
Certainly. Cervical cancer is the fourth most common cancer among women globally. For 2020, it was estimated that there were about a bit more than 600,000 new cases of cervical cancer and about 340,000 deaths due to this cancer. Most importantly, about 90% of the new cancers and deaths are usually happening in low and middle income countries. So, cervical cancer is a public health problem globally, but thanks to developments over the last 3-4 decades, we now have a strategy to move forward and try to eliminate cervical cancer.
And Victoria, if we, you are WHO's Goodwill Ambassador and you speak very openly about raising awareness on cervical cancer. What is important for preventing cervical cancer? What do you think women and girls need to know?
Good morning. First, I'd like to say thank you for having me. I think the key things that we need to know that the most important for prevention is we need to be informed, we need to get early screening, and we need to get vaccinated. So I think what I really want for women and girls to know is this is the time for us to act. This is the time for us to empower ourselves to go to our providers, to ask those tough questions, to have the ability to be screened and to get these findings early, because the earlier we find any abnormal tissue biopsies or any potential precancerous lesions, if we catch them early enough, we can treat them and eliminate it. And if we get vaccinated with the HPV, human papillomavirus vaccine, we know that we can prevent cervical cancer by way of preventing HPV, because HPV, again, is linked to almost all cervical cancer cases. So I want, to have providers to make the care and treatment more accessible. And I think that's important for women and girls to know, is that we need to get the information. Yes, we need to do the preventative measures, which is the screening. That could be as simple as you going to see your gynecologist for your pap smear, and getting vaccinated and getting our children, our daughters vaccinated, and having those conversations with them about the HPV and how that can cause cervical cancer.
Thanks a lot, Victoria. I mean, Summer, you have a story with us to share, your own personal story about surviving cervical cancer. Can you feed into this conversation about raising awareness with women and girls and talking about cervical cancer? What was your experience like?
Hi everyone, I'm Summer from Singapore. So I would like to share that the misconception about cervical cancer is that so most people think that cervical cancer only happens to women at an age beyond 35 years old. But however, I am diagnosed at the age of 24, so which means that cervical cancer does not only happen to women older than 35 years old, but also when you are below 30 as well. So as a youth, I got it at 24, and I have my first relapse when I was 25 and a second relapse when I was 26. So I was battling 3 times with cervical cancer, and that really can show that age is not really the main issue, but also getting the vaccine. Because when I was young, I didn't know anything about the vaccine, so I did not get the vaccine. And if I would have known about it, I might even avoid having cervical cancer in the first place. So that's one thing that I want to share, the age. And the second one is people think that cervical cancer is linked to sexual disease like AIDS, which is not true. Because and the thing is that because there's this misconception that people think that HPV and cervical cancer is linked to sexual disease, they dare not talk about it, which at the same time means that they dare not even go for the vaccine or the screening in the first place. And so even when I told my mom about my diagnosis, my mom was like scolding me, saying that I shouldn't have my previous boyfriends before, because if I don't have so many boyfriends last time, then I would not get the disease in the first place. But which is not true, because HPV or cervical cancer doesn't mean that your whole life having one partner. It kind of also means that you are exposed to this virus as well. It's not only because you have multiple partners in last time, but that means that you have higher chances. But the thing is that the moment you have any kind of intercourse with anyone, even just one partner for your whole lifetime, you still exposed to the virus. So that's the second thing that I want to address. It's the misconception about it being a sexual disease, which is not. It's just a virus, which is as common as a common flu. As long as you get it treated and get a vaccine, you can just eliminate it and prevent it altogether. And the third thing that I want to share is that in the world, people think that only women should take the vaccine and not the men. But however, men is also a carrier of the disease as well. But even the doctors, when I went to see them or to check on my condition, the doctors do not even know that men should also get a vaccine. Because when I was dating a guy, after I survived cervical cancer, the doctor actually told my boyfriend then that he should get the vaccine because he needs to protect himself against me. It sounded like I am like someone who will pass on disease to anyone because I had cervical cancer before. It really hurt me a lot, and me and my boyfriend break up then because he was scared of me because of that. And the way the doctor put it in that sense, I know that maybe it's not his intention, but it just doesn't put across the message correctly. So I would like to share that men should also get a vaccine and not only women. Yeah.
Summer, it must be hard to recount those moments of facing the disease burden and also facing this kind of discriminatory attitude in a way, and so much lack of awareness. So it's so important and so brave of you as a youth advocate to speak about it openly and to really address this concern. So if I could segue to Victoria, and Victoria, what kind of challenges do you face as a WHO Goodwill Ambassador to raise awareness on this topic? Clearly, there is a dire need to also tackle discrimination and stigma. And could you just speak to that? Like, what kind of advocacy efforts are needed now more than ever?
I think that we need to remember, the advocacy that needs to be done is that we need to know that we're all in this together. That means people, the providers, and the policy makers. We need to all have the same amount of urgency about this situation. We need to get more accessibility to not just the care, but the information about the care. I may be a medical professional as a nurse, but I've had my own journey with getting my screenings and not even, being aware of certain things because my provider had not talked to me about it, because that wasn't like one of the top key points that they were worried about. You get your annual visits, everything's fine. So we didn't really talk about that. But I did have to have discussions with my children's doctors about, HPV vaccines and things. And I felt like I got more information from my kid's pediatrician than I did from my own gynecologist. So I think that that's where we need to really focus on the most, is not only putting it on the onus on people to educate themselves, but as providers to make sure that we're giving people the information of the importance of preventionary care and not reactionary care. If we catch things early, we can almost always treat them and get rid of them as long as we catch them on time. But if we're not giving the people the proper resources and information, then they don't know what they need to do to be a partner in their care.
Thanks a lot, Victoria, for making that point. And Maribel, could you tell us that WHO has goals for eliminating cervical cancer? Are we really on track? And what shifts need to happen so that we achieve these targets?
Yes, I would like to start by mentioning a couple of things before moving into the elimination. So I want to start by saying that the main cause of cervical cancer is, as you've been clearing, HPV infection. But not only HPV infection per se, but persistent HPV infection. That means that we all get the infection at some point in our lives when we start sexual life. During our life, we may have HPV infection every now and then. But most of us, we get rid of it spontaneously. And only a small proportion of women will actually have it permanent with them. They will not be able to get rid of it spontaneously. And this is the main cause of cervical cancer. And this is how we actually, with the latest developments, we've been able to develop tools that will help us completely to prevent cervical cancer, which is a very preventable disease. So there are three pillars in the elimination. The first pillar concerns HPV vaccination. So we would like to have 90% of girls aged 9 to 14 years to be vaccinated against HPV infection. The second pillar deals with screening. And we would like 70% of women to be screened with a high performance test, and 90% of those who test positive for this test to be adequately treated. And finally, in the third pillar, for those women who unfortunately develop cervical cancer, we would like to have 90% of them adequately treated or managed, or given any clinical management that is available for them. So these are the three pillars of the strategy for the cervical cancer elimination globally. Now, how far we are within these goals? We put these goals to be reached by each country by 2030. However, we have to face the reality that not long ago we had the COVID pandemic. So many of the plans that were preparing or were being prepared to actually launch the different strategies and interventions to reach the goals for 2030 were severely delayed. Nevertheless, countries are moving slowly. We can talk about many countries now that have started to vaccinate girls at the age of 9 to 14 years to start. And we have many good news because just recently we released the policy that that girls can receive 1 or 2 doses of HPV vaccine. So there is the possibility of having only 1 dose, which actually increases and facilitates the coverage of more girls worldwide. So this is super important also because that will give the more the probability to more girls to really get vaccinated on time before sexual debut so that they can be protected for HPV infection, for cervical cancer, cervical pre-cancer lesions, and for cervical cancer eventually. Additionally to this, there are many countries and there are several international organizations that are supporting the start of screening and treatment in several countries. And this is moving quite slowly because screening is quite a complex process. However, it's becoming available slowly, as I said, but we are moving there. So although we would have liked to be a lot more advanced right now, we should not be discouraged because all these interventions always take time to be deployed everywhere. But the most important thing, as mentioned by Victoria, is that we are all together in this. And because of all these efforts that are putting globally together, we will try to progress faster towards our goals for 2030.
Thanks a lot, Maribel. I mean, there are all these strategic goals that are in place, and it is very important to prioritize, like you said. Could you repeat that age group that women should get vaccinated, girls should get vaccinated to prevent
Yes.
cervical? Because I don't think our audience heard that very well. So, and that's an important question that's been coming up.
Okay, so WHO recommends that girls aged 9 to 14 years of age should get vaccinated against HPV with 1 or 2 doses. That's the latest recommendation. Of course, there is evidence that the vaccine also protects further on young women. So women up to 20 years can also get vaccinated with 1 or 2 doses, preferably with 2 doses. And if a woman, this is what we call the catch-up, so for those girls that didn't have the opportunity for different reasons to get vaccinated at 9 to 14, they can still get vaccinated up to being 20. Even if they are older than 20, they can get vaccinated, but the protection of the vaccine is reduced. And that's why the vaccine has to be repeated probably every 6 months. There is also another important group, which is the immunocompromised HIV, unfortunately HIV infected women who actually need to receive a minimum of 2 doses and most preferably 3 doses necessary to be protected against them.
All right. That's pretty comprehensive in terms of when you should get vaccinated and how protection decreases after the age of 20 and the frequency of the vaccination regimen should increase. Now, Victoria, you're a descendant of Henrietta Lacks family, and her cells were taken without her consent, and she has obviously been the reason behind various medical breakthroughs. Could you just narrate that story for us and help us understand the importance of Henrietta Lacks's legacy and also regarding cervical cancer?
Yes. So Henrietta Lacks is my grandfather, Lawrence Lacks's mother. She died untimely in 1951 from cervical cancer. Before her death, she went to seek treatment. A biopsy was taken of her lesion without her knowledge, and her cells they started to research them, and her cells lived outside the human body, the very first line of cells to live outside the human body, so that researchers could make it possible for us to have vaccines such as the HPV human papillomavirus vaccine. Knowing that my grandfather had to watch his mother suffer through that cervical cancer and the lack of information and treatment and care that she received, but knowing that out of all of that suffering, her youngest children not even getting to have memories of her or to know her because she died not long after having her 5th child. And knowing that HPV vaccine came about because of those cells that were taken without her permission should be reason enough for us to not continue to die have the mortality for cervical cancer at these alarming rates that we have. I want everybody to have access to the HPV vaccine. Women all over the world, women, men, whomever needs to get the vaccine. Right now, I know that there's issue with how much vaccine, and that's why we're right now, the first cry is for women, more women and young girls to get vaccinated first. So knowing that my family's history and that suffering that came along with that, and that I've never had the privilege to meet or talk to my great grandmother, makes me even more passionate about this work and makes me want to get the information, the proper information out to more women, girls, and even their other family members. We don't want to be exclusionary. So we want everybody to get this information because each one should teach one. So we know that most conversations in the families go, the younger ones learn something, they come and tell the elders. So it should go both ways. We want everybody to be informed about what their options are, how we can prevent cervical cancer, and how that prevention can lead us to eliminating it.
And I'm coming to Summer, who shared very bravely her experience of surviving cervical cancer. Summer, there is also the story of vast inequality. How far have we come in addressing this injustice? You have kind of addressed it a bit in terms of information gaps and what you faced personally. But in your youth advocacy groups, what is the kind of awareness you do so that these kind of difficult topics are tackled? Your audio is
Sorry.
the clapping.
Yes. I think because we're trying to let the youth to feel. I mean, rather like to really get a vaccine, because the younger you get a vaccine, the so-called the more effective the vaccine will be. So we are really targeting about the youth first, and we've got to that because the younger people, they love something fun, something creative, all the trendy stuff. So we're trying to make it more fun and trendy. So we actually came up with a song and a dance to get the youth moving as well. So that's one part that we're doing. But I think we are currently facing some difficulties trying to educate the doctors, because it will be it's like questioning their profession. So that's something I would really need WHO to also help. To support us in that, because educating the doctors will be a very huge challenge for us. But yeah, so but mainly we are trying to educate the youth and the public more, especially the women and also the boys, rather like getting the boys to actually get the vaccine in Singapore. Because I think in Singapore right now, it's compulsory to get vaccine for the girls at the age of 9 in school, but not so much for the boys. So I think I heard that because there's a low supply of the vaccine. I'm not sure if that's the case, but yeah, I mean, I'm glad that currently Singapore is already doing this extra like proactiveness to initiative to give the girls a vaccine and make it compulsory as well. So at least we see some efforts the government is helping and doing for us already. But on the doctor side, we are hoping to see more improvement on that. Yeah.
Indeed, access and inequity is such a big topic in public health issues, and this is something that WHO is working consistently on a policy level. But to end this live, I would just like to pose our guests here. What is your call to action for this January, for the Cervical Cancer Awareness Month? What is that one line you want our audience to remember? I'll start with Victoria first and then go over to the others.
I'll say it again. My one line is still, we are all in this together. I need people, providers, and policy makers to come together with the same intention and the same energy to show that this is a reproductive and public health issue. Okay, it's not just about women's health. it's a public health issue. Let's look at it like that, and we need to all work together to get the awareness out there, the information for the preventionary measures and about the vaccination.
And Maribel, what would be your call of action as WHO's lead for screening and testing?
So I would say that we have to understand and have it clear that cervical cancer is a disease that is fully preventable. And I would say to women to inform themselves on how to get protected. And once you know it, tell it to others. Tell it to your mother, to your grandmother, to your aunt, to your friends, to your husband, to all your family and friends and people that you know, that they can also get protected. There are tools. We have the vaccine if you are young enough, or if you have access to it. We have screening and treatment. Everything is there, and we should look for that, and we should get informed on time. Today is the day to get there and get informed and tell others how to get protected.
Summer, coming to you, you're one of our most compelling guests who kind of put everything in perspective from an experiential point of view. So any call to action or anything that you would like to say to our audiences today?
Yeah, so I would like to say that yes, it's as important is to help others, but I think I want to bring everyone back to yourself, which means self-love, like loving yourself. And how do you really love yourself is taking control of your own life. And how do you take control of your life is to protect and care for yourself. Like, so taking the vaccine, going for the screening is one way to loving yourself and protecting yourself. So if you're being in control, you can actually do so much more for yourself, like really loving yourself, thinking what other ways to actually, how can you lead a better life, eating the food, healthy food, having a healthy lifestyle, getting all the vaccines that you might need, even for the COVID, and for HPV, whatever that it takes for you to lead a better life. I think that's what you should do for your own self. Yeah, so I think the one thing is self-love for me.
That's a very powerful note to tie the conversation together, how important it is to take care of our health and also champion health for all. That is what WHO is there for. And getting informed, getting screened, and getting tested is key. Cervical cancer is completely preventable. I thank all my guests for joining today. And with that, we end today's live. Thank you very much for joining.
Thank you.